Coming up on the Doctor's Hospital podcast.
Recent research, in fact, shows that screen media may have serious adverse effects on children's overall health. There have been studies that show that these children may present with depression, anxiety. It puts them at risk for things like cyberbullying.
Experience the immediate care you deserve at Doctor's Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctor's Hospital West on Blake Road for immediate, trusted, and best care.
Welcome to the Doctor's Hospital podcast. I'm your host, Alexis Burrows, Marketing Director here at Doctor's Hospital. And today we are continuing our Back to School podcast series, talking about how to manage the digital space with one of our very own family medicine physicians, Dr. Vashti Darling. Welcome back to the show. I know this is not your first time. We're happy to have you back.
Thank you for having me again.
And so, we want to continue. We've had an ongoing conversation all through the month of August with a number of different healthcare providers, physicians, pediatricians, mental health specialists on a lot of different topics as people prepare, parents and kids prepare to get back into the swing of school. Obviously, we are, I think, for some schools went back this week. Some schools are going back next week, and obviously by the time we get to that first week in September, then everybody will be back in classroom. So one of the things we want to talk about, a key component of discussing kids and their engagement with school is the management of the digital space, right? Obviously, we know that more and more technology, screens, and that whole entire component has become a larger segment of how kids engage in their educational life and their educational development. Even when you go back just 3 or 4 years ago, pre-pandemic, there's been such a drastic shift coming out of COVID, even in terms of an even deeper engagement with technology. So one of the things I know a lot of parents then become concerned with is, how much screen time is too much. How do you manage this whole process, and how do you make sure that you're making decisions that are best for your kid, your student, so to speak. So we're going to dive into that with you today, and give our listeners, like I said, parents and kids alike, and even, people who work in the education system, some answers to kind of help guide that process for them. So to get started, I think for most people, if they were honest in their answers, they would say, if you ask them, do you think that your kids have too much screen time? I think a lot of parents would probably default and say yes if they're being honest, right? But how does excessive screen time impact a child's physical and mental health? And then, does that vary depending on if they're 6, 7, 8 versus, 13, 14? And kind of what does that look like?
Okay. Like I said, thanks for having me again. And screen time is a very big topic, especially in school-age children. Mm-hmm. It's a component of our school health examination, something that we, in maybe 10 years ago, didn't exist, didn't hone in too much on, but now it's a vital component of our line of questioning.
Right.
And recent research, in fact, shows that screen media may have serious adverse effects on children's overall health over a long period of time. Mm-hmm. More specifically, mental health and physical health. So when we take a look at physical health, excessive screen time, you can see where it can promote a sedentary lifestyle. So kids would, unknown to some parents, be on their screens 4, 5, 6 hours at a time. Mm-hmm. That's sitting in one position, engaging in no physical activity. And of course, that in turn leads to childhood obesity. Mm-hmm. Which in turn leads to the propensity for chronic illnesses like hypertension and diabetes and eventually metabolic syndrome. So it's a vicious cycle. It's a domino effect. Mm-hmm. When we talk about physical health, poor posture. You're sitting up hours at a time.
That's true.
You may find that a child comes in with their parent complaining of back pain. Our grandparents used to tell us, you ain't got no back, right? But you take a history and you ask them about screen time. Especially over the summer, they're sitting in one position hours on end, whether it be on a tablet, on a phone, or gaming perhaps, and they're not moving. So they're coming in complaining of back pain, neck pain, and this is sometimes the underlying reason. And, and in some instances, you do an x-ray and you can actually see changes related to the loss of curvature. They're having muscle spasms, etc.
Yeah, it's wild to think about because, when you think about kids, especially when you're talking about school age children, so basically anywhere between like 4, 5, 6, and I guess 16, 17, 18, for a lot of that time frame, they're still developing, right? So it's like to have issues with your back as your back is still, becoming an adult back, so to speak.
Absolutely.
It is, I guess, potentially a lot more risky than even for someone who's like, our back is already what it is. My back, your back is what it is, right? So like we only damage it what's already been fully formed. But if you actually get damage while it's still trying to develop and fully form into, that, I guess it's potentially a lot more problematic. I do find it funny too, though, like when you talk about, 10 years ago, this didn't exist to the same degree in terms of the type of questioning. Like I always tell people, I feel like I'm a middle child in the age of technology because, when I was, 7, 8, 9, I would go to the family islands. Like I spent summers in Long Island and we did not have electricity. We used to have to walk down to the Batelco office to call home. There was no such thing as a screen. You end up there for summer and you was riding your bike, going fishing, going on the boat, going swimming. That's what it was. So it is very different, because like my 7th grade class in SAC, that was the first year where we had computer as a class from 7th grade all the way up. So even for our demographic, it's a little bit different because our engagement with technology started a fair bit later. Like now I have a 6-year-old and, she kind of has had an idea of what technology is basically from the minute she hopped out of the womb.
Definitely. It's being introduced at a very early age.
And so even if you do, the right thing and keep them away from screens, so to speak, before they're 2, they see you engaging and having it. So they still have their way around it very early on. So it does start a lot earlier, I imagine, now than it did for, I'm turning 40 this year. So somebody like me, my engagement with technology didn't really start until, like I said, like fully until I was in high school, which is still a little bit different.
Right.
You see kids running around at dinner with a Amazon tablet at 4 years old with their headphones on. So it's very different.
Very much so. And in terms of physical health, outside of the obesity, the sedentary lifestyle, we were even seeing more visual problems in terms of sight. Okay, as a part of our school health, we tend to do visual screening, visual acuity, and you're finding more and more that these kids' acuity has been affected. And, that could quite in fact be due to the increased amount of screen time, the blue light that's emitted from the screen and the effect that has on the vision and even the effect it has on sleep. Okay, if you're using screen before bedtime, there have been studies that show that, this can too affect your quality of sleep. So it has a very broad range of adverse effects in terms of the physical health.
Okay, so, we talked about, and I think you kind of tapped into this a little bit already, but what are some of the other potential long-term effects of digital device use on things like sleep patterns, for, again, looking at specifically, school-age kids?
So as I would have mentioned, well, we know that sleep is a very important part of your child's development. So it's a question worth looking into. And the time spent on screen devices can affect the quality of sleep, and not only the quality of sleep, but the duration of sleep. In turn, again, that domino effect leading to multiple health impairments. Not getting enough sleep can in turn affect your mental health. So when we talk about screen time and mental health, you have impaired concentration, which in turn affects the child's ability to focus, and you may see a decline in their performance in school. So again, it's one thing that leads to the other. There have been studies that show that these children may present with depression, anxiety. It puts them at risk for things like cyberbullying that we'll talk a little bit more about later. But getting back to sleep, the American Academy of Pediatrics recommends that children between the ages of 6 and 13 should get 9 to 11 hours of sleep at night. And teens between 14 and 17 should actually aim for 8 to 10 hours. And if you really dig deep into the history, very often these kids are up 3, 4 o'clock in the morning on their devices, and their parents are fast asleep. So that leaves them getting maybe 4 hours of sleep, 3, 4 hours at most.
Yeah.
And when, it's time to get up in the morning, nothing happening. They're groggy, they're grumpy, they're miserable. And even in some instances, you would have your parent-teacher conference and your teacher's reporting the child has fallen asleep in class.
Mm-hmm.
So sleep is a very important component of development.
Mm-hmm.
And screen time can certainly affect that in a negative way.
Yeah, because I think, I think a part of it is like setting guidelines and structures in the home. So like, for example, my 6-year-old doesn't have a device of her own. And even the device that we allow her to use, that never goes like past 6, 7 o'clock. That's not in any room where she is. You know what I mean? Like, it's not in her bedroom. It's not anything like that. And that's a part of the reason, because you kind of see if you have screen time too close to bedtime, there's difficulty in getting to sleep. And I imagine it's very normal behavior that people will see, and so I think a part of it is just setting those sorts of ground rules to say, hey, look, once you get past a certain time, if you're within an hour or two of bedtime, there's no screen, there's no devices left in any rooms. And even if you have to go as far as locking the device away somewhere where they can't access it, I mean, sometimes you kind of have to go that far, right? Because if they know that they can access it and there's no real structure to prevent them from doing it, then you kind of have that, you run the risk, basically.
Yeah, those boundaries have to be established, and they have to be established very early on.
Mm-hmm. And then you have to stick to your guns.
Oh, definitely.
Because kids, their whole gimmick is trying to, push the boundaries as far as they can. They like structure, they like discipline, but they also like to see, just
let me try it.
How much more can I get away with? And you kind of have to be firm in it, because I think a lot of times, we hear people talk about things like capacity and stuff like that, and it's like, okay, I don't really have the capacity to deal, so let me just put them in front of the TV or put the tablet in their hands or whatever. But you have to consider the potential risk that you're running with that kind of overexposure. And I guess it's that recognition that it is overexposure when you talk about, how much time they're spending on screens, especially in the space of foolish content. Because a lot of what we have out there now is just mindless content. Like, I know we had this conversation with someone else during the series, and it's like, well, there's a difference if you're someone who's interested in art or graphic design, for example, and you're on YouTube looking at tutorials and things like that. It's something that's you're learning or you're developing or you're honing in on a skill. That's different than, well, I'm just watching Skibbity Toilet for 6 hours on it.
Right, which is why you have to encourage parents to monitor the content. And there has to be a balance between leisure and learning.
Right.
You mentioned that, in the era of COVID, a lot of this has changed based on the virtual schooling and whatnot. So, even when you ask parents in the presence of the kids or ask the children in the presence of the parents, rather, how much time do you spend on a screen? You have to be very specific and establish how much of that is recreational time versus learning.
Yeah. Because sometimes, there's these apps and settings in the devices. You could say, well, 2 hours at a time or 3 hours at a time, but you want to be mindful as to what it is that they're engaging with, because there's still levels and layers to it. It's not just as simple as, well, you get 2 hours on the tablet, because then you might be hindering them from expanding on a gift or a talent or enhancing some skill that they're on a deep dive in, and you want to be able to allow some wiggle room for things like that.
Or even for educational purposes,
right.
Which is why the monitoring plays a very important role. And as a parent, you have to be very involved in what it is your kids are exposed to.
Mm-hmm. Well, you can't do the disconnected parent. That doesn't quite work. All right. We are having a very interesting conversation with Dr. Vashti Darling, talking about technology and digital health as a part of our Back to School podcast series. We're going to take a quick break for some words from our sponsors, and we'll be right back on the Doctor's Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation with Dr. Vashti Darling about technology and digital health as a part of our ongoing Back to School podcast series. So the next question is a very interesting one because oftentimes people don't think about technology and screens as an addiction, but I think the more we see research and the more we see data come out, it's becoming very clear that it has the same sort of effects on the brain as an addiction to anything else, whether that's an illicit drug, whether it's alcohol, whether it's food, anything in that regards, it operates the same way. So what are some signs, as a parent or a guardian, or even as a teacher, what are some signs that, you can look out for to say that a child might be experiencing a digital addiction? And then how can you assist in addressing that issue?
Very good question. And some of these things we highlighted a little bit earlier.
Mm-hmm.
For example, lack of attention, loss of focus, a decline in grades.
Mm-hmm.
If you notice that the child previously was a solid 3.0 student, and now we're, steadily dropping,
Mm-hmm.
2 point, barely scraping a 2 point, you have to question, is there something going on?
Right.
The other thing you want to look for, especially in our younger kids, those who tend to throw tantrums
Mm-hmm.
when they don't have access to the tablet. Okay. And the only thing that will pacify them is giving them access to the tablet. That you want to be mindful of that as well. And our teenagers, those who are avoiding social interaction. So, they don't want to come to the family functions. They would rather be locked in the room on the gaming device, on the tablet. They neglect their responsibilities. As it is, you may have a hard time, but, even more so now with them being on the screen 4 to 6 hours a day. Those are the sorts of things that you want to pay attention to.
Right.
The sleep problems, not sleeping during the night. They're sleeping all day. You find that, especially during the summer. I had a pediatric patient the other day for a school health examination. Asked her, how many hours do you sleep? Well, I go to bed around 2, so I wake up around 1 in the afternoon. What are you doing until 2 in the morning?
That's wild.
Right? So, and then of course, they're on the social media apps. So you want to ask about that as well. What's keeping them on these apps? Is it that they're being drawn in by the wrong crowds, being lured into doing things that they shouldn't be doing? So those are the kinds of things that you want to look out for when we talk about screen or device addiction. And in terms of addressing these issues, you want to set certain measures. You want to put measures in place. And the first thing to be aware of is setting limits as far as screen usage. So as young as 0 to 18 months, you want to avoid the screen altogether. Yeah. Okay. Unless it's, a video call with a family member or something like that. But outside of that, you shouldn't be using the screen to engage the child.
Right.
Okay. This is when you should be reading to the child, singing, playing along. Okay. Between the ages of 18 to 24 months, so that's 18 to 2 years, you want to limit your use to less than an hour.
Okay.
Now, previously, AAP, or the American Academy of Pediatrics, their guidelines went as far as saying 2 hours, but they've even pulled back on that, right? And our kids between 2 to 5 years, an hour max is what the recommendation is. And anything over 6 years, an hour and a half max.
Oh, boy.
So when we break this news down to the parents and the kids, the reaction is usually like, that's all? But that's what the recommendation is. Outside of setting those limits, as a parent, you have to be a role model. You can't say, do as I say, not do as I do. You have to practice what you preach. So if you're finding yourself always in your phone, always on the computer, your child is going to think that's okay.
Yeah, because they're going to see it as normal.
Right.
Like whatever mommy and daddy does is what we do.
Exactly. Yeah. So you too have to set some limits for yourself, especially in the presence of the children. And as I mentioned earlier, you want to balance the learning versus the leisure.
Right.
Okay, it's okay to have a little fun, a little recreational time, but you also want to incorporate educational activities
Mm-hmm.
and be mindful of what it is that the child is being exposed to, trying to weed out any or filter out any violent content,
Mm-hmm.
sexually inappropriate content.
Yeah.
Okay, all of that is extremely important. And then you want to establish a routine. Okay, routines are excellent when it comes to child development. You want to set a routine that includes time specifically for meals.
Mm-hmm.
And during those times, there shouldn't be any screen time. Okay, time for homework, time for exercise. All of these things will help to create a routine for the child and in turn decrease the number of screen time that they're exposed to.
Yeah. I mean, the content one is also a critical part of that as well. Like I know we had an incident a while back. My kid was at a camp and another kid had said to her something along the lines of, they were going to burn the house down with the family inside and all that. And so when we investigated it, apparently what it was the kid watched their dad play a violent video game. And so there was no filter.
Right.
You're talking about like the kid was like 5-6 years old. And so this isn't even like a teenager where there's some level of understanding.
Right from wrong.
Right.
Exactly.
And so, we have to be mindful because then, they take that back into school environments and these other places and they have no real grasp of even the gravity of what they say when they go and repeat things back.
And at that age, there's no critical thinking.
At all. Zero.
So, though that too is something that parents also need to try and establish. You want to encourage your children to think critically, to know the difference between right and wrong. Okay. You also want parents to inform their children about online risks. Everything you're exposed to online is not good. The internet is a very powerful tool. It can be used for good, but it can also be used for bad. So these things parents have to make children aware of, not to share your location, not to share your address. Just how we have stranger danger in person, the same thing should be promoted with the online use.
Online activity. Yeah.
Exactly.
It's funny. You really have to be present.
Most definitely. And you have to stay informed. There are trends that come up online that, challenges and whatnot that kids are exposed to. And you as a parent, if you're in the dark and you're not aware of it, these things will be going on right under your nose and you wouldn't even know it.
And while there may be some things that are harmless, there's a lot of those things that are challenges that are either, potentially a challenge from a sexual standpoint, from a violence or harm to themselves standpoint, because it's just the internet is a crazy place. It's as used for good as it is for bad, and I think people have to remember that and be very, very present. Like I know, like I said, I came up in a time where you were talking earlier about the effect of the screens on the eyesight and things like that. Like, you turn TV on, it's like, if that TV on for more than an hour, you won't be able to see, you need glasses. And, I don't know that they was right or wrong at that point, but we also, these are the sorts of conversations, right? And so it's interesting when you think about that, because you have to know. I think the world that we live in is in some ways a lot different, but very much still the same. I think it still requires the same level of being present and knowing what's going on. And not just because you're not just plopping your kid down in front of that nest to watch, Barney and Sesame Street and stuff
anymore.
like that. This is not the space that we live in anymore.
No.
So all of that you have to bear in mind. Kind of going back to the idea of screen time, though, we talked about balancing even between like leisure and learning. But, what advice can you give parents about balancing screen time with like physical activity? Because you mentioned earlier the concept of, if you have excessive screen time, one of the things you run into is potentially a sedentary lifestyle, obesity, and then all of the non-communicables that come after that. So how can parents help to balance that, especially if you might already be dealing with a kid who has some level of addiction going on?
Right. So you want to establish what we call tech-free zones. So those would be zones in the home that there are no devices.
Okay.
Right. For example, the bedroom. The bedroom is to go to sleep.
Right.
Okay. The dinner table. When we're at dinner, it's family time. We're talking to each other. We're interacting. You shouldn't be at the dinner table with your device in hand.
Right.
And that should be for the entire family, not just the children. Okay. So establishing those tech-free zones, set boundaries. And you do that from a very early age. So it can be, we spoke about routine. So it can become a routine so that as the child gets older, it's established.
Mm-hmm.
We know that the bedroom is a tech-free zone. The dinner table is a tech-free zone.
Mm-hmm.
You want to enroll your kids into sporting clubs or physical activities
Mm-hmm.
to keep them active, right? Encourage outdoor play. Encourage family activities that, the entire family is
Mm-hmm.
involved. So, go into the park.
Mm-hmm.
It may seem trivial or, but go into the beach even. Something that gets you out of the home, something that gets you moving
Yeah.
and thereby increase, in turn, improving your physical health.
Mm-hmm. I mean, I think even sometimes that improves your mental health because it's like just getting out of the four walls of your home, getting some fresh air, getting some sunlight.
Mm-hmm.
Even if you just like, sometimes you it's really hot here, so you might not want to do like the full walk on, but even to say you go for a drive and just get exposure to being outside, a brief walk, something that says, we're just not in the same four walls because, that impacts even from a mental perspective, just how you feel about it. Because if you feel like you're just cooped up in the same four walls every day for large chunks of time, you're going to feel trapped like in life. And so you want to make sure that you think about it from that perspective as well. But yeah, I mean, I think sometimes people get a little like, well, if I can't do, a 15-minute mile, then why should I go walking? And it's like, just get outside and get some fresh air and get some sun.
Get the heart rate up.
Get something going.
Get moving.
Mm-hmm. All right. So one final question before we wrap up. I think we've touched on this here and there through our conversation today. But what advice would you give to parents who are concerned about the impact of social media on their child's self-esteem and mental health?
So as far as parenting and your role as a parent,
Mm-hmm.
you'd find that open communication is key.
Mm-hmm.
You want to encourage your child at any age to be able to come to you and talk to you about what's going on, whether it's online or at home or in the classroom.
Mm-hmm.
You want to promote healthy, open communication with your kids. And you want to foster an environment where children can discuss their online experiences, concerns, challenges. Like if someone were to approach them online, you want them to be open enough with mommy or daddy to say, look, mommy, this person tried to say something to me and I don't think it was right. Okay, so open communication is extremely important.
Mm-hmm.
And fostering that environment is one of the key components of reassuring parents in terms of how to lower the impact of social media, making the child feel more comfortable.
Mm-hmm. Yeah, at this point, I think we've seen so many stories about cyberbullying and online bullying and things like that. And even just, I think sometimes is the understanding of not everything that you see. Sorry, let me rephrase that. A lot of what you see on social media is a lot of times not true, even in terms of just the physical presentation of people, whether that's because of using filters, whether that's because of all of the surgical enhancements that we see that people are so popular and are so into nowadays. So even, from that standpoint, to think that if you don't look this way,
right,
or, if your skin doesn't glow, like most people's skin don't just glow. Like it's a filter.
Yeah.
You know what I mean?
So self-image is very important. And that's actually a component of our school health examination as well.
Mm-hmm.
We ask kids, how do you feel about yourself? Is there anything physically about yourself that you're not comfortable with?
Right.
And a lot of time the ideals that are portrayed online are completely false.
Mm-hmm.
So very often I would find myself just giving pep talks to kids, encouraging them. And I think that's something that the parents should be doing as well.
Right.
Words of affirmation,
Mm-hmm.
reminding them that they're beautiful, such that they don't allow what they see on social media to impact their self-esteem.
Right. And you start that from young.
Very young.
Yeah. I think it's funny. So many of our conversations over the past few months on the podcast, it keeps coming back to early intervention. And it's the same thing here, right? It's like you want to be that voice very early on that is affirming and giving positive messages and positive feedback, because then they have a base that they're grounded in when they start to see all of these other things out in the world. And when people try to tell them otherwise, they have that kind of solidified base at home to say, no, you are this and you are that. All of these positive, reaffirming messages, and not just because the world is a crazy place. And there's a lot of negativity out there, and there's a lot of, trying to get people into spaces that are not safe and not healthy. And so the parents being involved very early on is very critical. So thank you so much, Dr. Darling. This has been a very enlightening and engaging conversation. You mentioned a couple of times the exams. Mm-hmm. So right now, as we prepare for back to school, Doctors Hospital is actually offering some discounted school medical packages. So anytime now until September, if you've not yet done your back to school physical, you can feel free to stop by any one of our primary care clinics. That would be Carmichael Medical Center, Centerville Medical Center, or Dowsville Medical Center, which is where Dr. Darling works. And we have 3 packages available, ranging from $100 plus VAT up into $170 plus VAT, depending on what the needs are of your school, especially if you're looking at like college applications and things like that as well. So all of those are available. And as a part of our ongoing engagement with the community, as we, do education and things like that for back to school, we are having a back to school health fair hosted by our Carmichael Medical Center on Saturday, October 31st from 12 p.m. to 4 p.m. at the Flamingo Gardens Park. We will be doing backpack giveaways. There'll be a bouncing castle and face painting for kids. We're going to have free snacks, free health checks, so you can get your blood pressure, your blood glucose, and nutritional education. And then we'll also have, for some of our older students, our IOL team, our Institute of Learning team, will be there to talk about some of the medical programs that we offer in terms of education. And then we have LAMP sign up available for the whole family. So if you are interested in any of those things, you can join Doctors Hospital on Saturday, August 31st from 12 to 4 at the Flamingo Gardens Park. And that's a part of, like I said, our ongoing engagement with the community as we try to get everybody ready for going back to school. So thank you again, Dr. Darling, for taking time out of your busy schedule.
My pleasure.
You left the patients alone for a little bit so you can come and chat with us. And then for our listeners, as always, we invite you to like, comment, subscribe, and most importantly, share. There's a lot of good information in today's conversation and throughout this entire back to school series that we've been doing. And as always, we invite you to join us back here next week on the Doctors Hospital podcast.
Your health just got brighter with Lamp Insured. Sign up for Doctors Hospital's Lamp Insurance Supplement Plan and enjoy copay waivers and complete access with no upfront ER or inpatient collections. Only $30 per month. Visit doctorshosp.com/lamp to sign up or contact 242-822-1009. That's 242-822-1009. Your journey to affordable and worry-free healthcare begins now.